Hi everyone, I'm Katie Lee Hornberger and I'm a certified genetic counselor, and today we're talking about chemical pregnancies. How do you know if you've had a chemical or biochemical pregnancy? First, let me say, if you're here because you or a loved one thinks you're experiencing a chemical pregnancy loss, I'm so sorry to hear that. I've been through 5 losses myself, and I know just how confusing and overwhelming and upsetting it can be to go through a pregnancy loss. So I'm speaking from my personal experience as well as my professional experience as a certified genetic counselor today. First, what is a chemical pregnancy? Well, a chemical pregnancy is a very early pregnancy loss that typically occurs around maybe 4 or 5 weeks of pregnancy. Pregnancy dating can be a little bit confusing, so you can think of that as about 2 or 3 weeks after ovulation or after the time of conception. A chemical pregnancy occurs when you have a positive pregnancy test. This could be a positive pregnancy test at home or at a doctor's office with a blood or serum test. So with a chemical pregnancy, you have this positive pregnancy test, but days or maybe a week or so later, you might get your period back or your pregnancy tests start coming back negative. Or if you're taking quantitative pregnancy tests where you actually get an HCG beta number at the doctor's office, that number starts dipping down or declining. So if you've been trying to conceive and you've been getting a positive pregnancy test that starts lightening or looks negative in the days that follow, that is probably a chemical pregnancy. What this typically means is that your pregnancy is not viable and that pregnancy has stopped developing. Now, I definitely suggest that if you think you're experiencing a chemical pregnancy, that you get an appointment with your OBGYN or message your OBGYN on the portal to see if they recommend anything, any follow-up studies, or having you come into the office. Even though chemical pregnancy losses or biochemical pregnancies are early and happen, just a number of weeks after conception, I know from personal experience they can be incredibly upsetting and disappointing and frustrating. So don't let anyone tell you otherwise. Early losses are still a loss, and we all might grieve or feel differently about that loss, and that's okay. Unfortunately, pregnancy losses are incredibly common. Many people might even have a chemical pregnancy and not even know about it if they're not monitoring, tracking, taking pregnancy tests that early in pregnancy. For example, if someone's trying to conceive or they're having unprotected sex, but they're not tracking their ovulation or when their period's expected, and they're not taking pregnancy tests around the time that their period is anticipated, they may not even know they have an early pregnancy loss. You may wonder if there's any specific symptoms or clues that could tell you if you're experiencing a chemical loss. Unfortunately, really the main way is by tracking that HCG or by taking these serial pregnancy tests to know. So if you're wondering about a past time where your period was a little late, but you didn't take pregnancy tests, you didn't have your HCG drawn, there is really no way to go back and to say, was that a chemical loss or was my period just a little bit late? Some people might experience a little bit of a heavier period than what's normal for them, or they might have a little bit more cramping than what's typical for their cycle, but not everyone necessarily has that with a chemical loss. So there's not a specific symptom or set of symptoms that could tell you whether or not you're experiencing a chemical loss besides those pregnancy tests. Similarly, some individuals who experience chemical losses may report some of those very early pregnancy signs like nausea or breast tenderness, and some people who experience chemical losses don't have any of those early signs of pregnancy like breast tenderness or nausea. A really common question is, what causes a chemical loss or one of these early pregnancy losses? And the answer is, oftentimes we just don't know. We know that a really common cause of first trimester pregnancy losses is chromosome imbalances. And I've got another video linked in my description below that explains the likelihood of pregnancy losses based on the age of the egg source and the conception. So chromosome imbalances could be a cause of a chemical loss, but there's not really a way to test or determine for certain what the cause is. And that can be frustrating, but it's important to know, even as someone who works in reproductive medicine, it is so clear to me every day how much is left to be understood about pregnancy, and specifically early pregnancies. There are a lot of factors that we just don't understand yet, and a lot of times it is impossible to say what the specific cause of a loss is. You might be wondering, is there anything I can do to prevent a loss in the future? Well, certainly you want to talk to your OBGYN or your prenatal care provider about your specific pregnancy history or fertility history or infertility history, so they can guide you to any appropriate testing based on that history. Unfortunately, most of the time, there's not something specific that can be done to prevent a loss, just like it isn't your fault when a pregnancy loss happens. There's not much in our control in terms of avoiding these early pregnancy losses. Unfortunately, these early pregnancy losses are just incredibly common and for the most part completely out of our control. If you're feeling like you need support after experiencing your loss, don't hesitate to reach out to your OBGYN, a therapist, or your friends and family, because even if they haven't told you, I would bet that most of us have friends or family members who have gone through early pregnancy losses and maybe haven't shared it. For me personally, it's brought a lot of relief and comfort to share my stories of my pregnancy losses and to connect with other people who've gone through similar losses and experiences. But there's so many different ways to cope and so many different feelings that someone might be experiencing when they go through a loss. So there's no one right way or one right feeling. If you're interested in other content about miscarriages or chemical pregnancies, check out my miscarriage and chemical pregnancy playlist below and some other related videos in the description below. Thanks so much for watching.